Well, again, thank you to everybody that's joined us today for this second session of the AgrAbility Virtual National Training Workshop 2018. This is our second session, and we'll be focusing on mental health first aid. Our presenter today is Dr. Roberta Schweitzer, and she has a lot of experience with this program and with other aspects of mental health treatment, so we're glad that she was able to join us today. I do want to introduce myself for those who may not know me. My name is Paul Jones. I manage the National AgrAbility Project, which is headquartered at Purdue University. Before we start with the actual presentation, I do have a few basic instructions for those who have not participated in our webinars before. You do have the option of either audio through your phone or your computer. Hopefully you have discovered that. If you need to check your connection or make any adjustments, please go to the Communicate menu at the top left of your screen. You can run your audio test or make other adjustments there. If you need closed captioning, you'll need to go to the Media Viewer window, which is on the right side of your screen in the right column, and click the down arrow next to that. You should be able to see the captions running. In some cases, you may have to enter a little bit of login information, but you can also make some adjustments to the size of the captioning and those types of things. If you want to expand or contract any of those windows on the right, just click on the arrows next to them. You can also expand or contract the whole column on the right side by clicking and dragging that boundary between the right column and the presentation window. If you have questions about the presentation, we're going to wait until the end for those. You have two options for asking your questions. You can go to the chat window, click on that, and you'll need to enter your message, and we ask that you send that to all panelists. That should be one of your options. All panelists is the best choice for us to be able to see those. Your other option is to ask a question verbally during the question and answer period. And to do that, you would need to use the raise hand icon, which hopefully you see near your name. If you click on that, we will do our best to enable your microphone or your phone connection, and you'll be able to ask your question verbally. After the main part of our presentation, we do have 4 quick survey questions to give us some feedback about the presentation. And then after the question and answer period is over, we'll open another poll that you may use to share any comments that you have. We are recording this session. And if you go to the agrability.org website and look under online training, you'll find a link for the virtual national training workshop. And we hope by next week to have all of our recordings up, along with the PowerPoints associated with them. If you happen to have any technical problems during the presentation, please try to share that through the chat window first. If you have problems or somehow get kicked out of the session, you can email me directly, jonesp@purdue.edu, which is also the email address that was used to send your instructions. So you can simply reply to that. Finally, for those who may not be familiar with AgrAbility, we are a program sponsored by the USDA, National Institute on Food and Agriculture. And our focus is on working with people in agriculture that have some type of disability or functional limitation. Every AgrAbility project around the country is a partnership between a land-grant university and at least one nonprofit disability services organization. Currently, there are 20 state AgrAbility projects around the country. There's also one national AgrAbility project, and again, that's led by the Breaking New Ground Resource Center here at Purdue University. Our partners on the National AgrAbility Grant are Goodwill of the Finger Lakes, APRIL, which is the Association of Programs for Rural Independent Living, Colorado State University, and Washington State University. If you have any more questions about AgrAbility, you'd like to find resources, find out whether your state has an AgrAbility project, or you can view some of the more than 50 archived webinars that we have on our website, please just make a visit to agrability.org. So at this point, I'm going to turn things over to Dr. Schweitzer. She will give the main body of the presentation, and then I will be returning for our poll questions and the question and answer period at the end.
We're on. Okay. Hi. Good afternoon. I'm Dr. Roberta Schweitzer, and I'm glad to be here. We just had a slight technical glitch there for a moment. It's a beautiful, sleety afternoon here at Purdue in Indiana, and I hope your weather is better than that. I know the East Coast is getting hit by all kinds of stuff right now. So, well, just to introduce this workshop, a little bit, I have been sponsored to take the mental health first aid training course as an educator, so I'm certified in that area, and I was very interested in this. I was sponsored by the AgrAbility program here at Purdue. My interest stems from way back when I started as a psych mental health nurse, and ever since I've been very interested in this area. And I also have a farming background. I was a kid of a farmer, small farmer here in Indiana, and I watched and had to deal with a lot of stresses along with my parents, as all kids do, and have learned a lot from that, and want to help farmers and ranchers and other rural folks out there as much as I can now. So I will tell you this presentation, first of all, is going to review just a little bit of stress, because that's not the main focus today, about stress and what it causes. We'll look at some of the most current issues today on farms and in rural areas that are of concern in mental health. And then I'll spend some time talking about mental health first aid. You may or may not have heard of the program, so I wanted to really make sure you understand what it's about and how well it would fit as a program to use with rural communities. It's very much in line with the rural beliefs and ways of living, so I'm hoping that you'll get something from this today and can maybe think about starting some classes in your area. So, as I was saying, mental health first aid is really important kind of process that's going on to work with communities that are underserved. And rural areas certainly are one of those areas. And we are hoping to increase wellness in those communities, not just physical, but mental too. So that is kind of the start of this. I have my little practice where I do workshops on my own and go wherever I need to do them. I'm happy to do that. So just as a background, you may or may not be aware that farming, ranching, rural employees, whether working in a out west or in the Midwest or wherever, that's one of the most stressful occupations in the United States, and it's in the top 10. So there are specific stressors that go along with many other stressors that people have in their work and jobs. And along with all the traditional things in an office job, there are also some of these areas I've listed below on the slide. Expenses, finances, that changes from day to day, and work to year and month to month. All kinds of issues that happen on the farm. You never know when your machines are going to break down or something is going to happen. You need to get something fixed or you run out of gas. Weather is another big issue. You can see all of these are areas that are in lack of control for the person who's doing the work, oftentimes alone. Now there are big farmers, big fields, lots of acres, but also many small farmers that have to face all this alone. Pressures, long hours. Again, if you have no other employees, you're the one that has to make it happen, get the crops in and out. A lot of hours involved in that. Chemicals, dangerous pesticides and so forth you may face go along with the stress, as well as just concern about, is my farm going to survive? Is my work going to be here for my kids or my family? And lastly, a lot of pain can come from injuries, arthritis, various things, illnesses, it's really a hard labor kind of job. It's getting easier, I think, with all the fancy equipment now. But I know my dad used to ride on a tractor that would bounce up and down and had a lot of arthritis problems as he got older. So there is pain and some suffering from that in some cases. The stress, as you may know, just as a review, builds up the more you've faced a lot of these stressors day to day. You can result in something called stress overload. And we have a stress response. And when that happens, physically, there are changes in our body, as well as emotionally, cognitively, and behaviorally. So when you're talking about the area of mental health, we don't have to start with like an illness, a big illness. We can start paying attention to the stress response and how it affects us in our everyday life. Physically, some people get a fast heart rate, they get shaky if they're stressed out. Some people emotionally might cry or be angry. Cognitively, you may have trouble remembering items or things you're doing. And behaviorally, you may end up sleeping a lot or who knows, some behavior that's not too helpful, such as alcohol or drugs in some ways. So again, stress response looks different in some people, but there are some common ground for all of them. If you don't listen and pay attention to your body and what's going on with you, you can build these stress responses to the point where they become an overload. And that's when you start getting into some difficulties in functioning in your day-to-day life, and can result in things like anxiety, depression, substance abuse, suicidal thoughts and actions, and other mental disorders that may come out of that. So there are consequences, and farm and rural people are not exempt from those. And sometimes we don't pay enough attention to that, or our families or our friends or people we work with around us. So the suicide actually is quite an issue right now. I believe I refer to this later, but it is a big problem in rural men, and I'll mention more on that later. So the other factor that goes along with this, along with not paying attention to what's going on in our bodies sometimes, we may not reach out for help. I know my dad was like that. He would never ask for help. He would never go to the doctor for anything if he could get out in the field. And so we kind of let things go, and that tends to add to that stress response and the overload that we might experience. Finally, a factor that's quite important that we're running into now is limited number of professionals out there that are mental health professionals. So there may not be any resources nearby or anybody that we know or feel comfortable in sharing this kind of information with. Medical, yes, we usually have a local doctor or a nurse practitioner, but oftentimes there's no mental health resource that's trained in that area. So part of what I'm doing today is looking at a program. Sorry, I skipped a slide here. The other issue that's going on besides the suicide problems is the opioid addictions and the epidemic that goes along with that. That is becoming a large event in the lives of many people in the United States. And as you can see, since the 2014 statistics, right now there are 6 out of every 10 deaths in this country that come from opioid overdose usually. Too much of a prescription or of an illegal drug, such as the heroin and methadone, so forth like that. So you can see opioid deaths have actually quadrupled since 1999. That's quite significant. I grew up and started my practice as an advanced practice nurse in a heroin addiction center, and that was in the 70s. And it's amazing to see it really coming full around again, and to realize that it's a problem we still haven't figured out how to solve. So a lot of that, as you know, is due to, initially, to medications that are prescribed. So when I'm thinking of farmers or rural ranchers and so forth, I'm thinking of those people who have that pain, who maybe they've gotten a prescription for an opioid and are in pain, legitimately need it. You might get a prescription for oxycodone or morphine, codeine, fentanyl, drugs like that, and tend to start using that as a mechanism to not only deal with pain that's physical but also emotional. So prescriptions can be used for pain control, but can also move beyond that and be used for issues that are beyond the physical pain. And that is really unfortunate when it happens because of the addiction properties, as well as heroin and methadone are all prone for addiction. And they're all products of the opium plant and come in various ways, legally and illegally, prescription or non-prescription, but still can be a problem, even though they're prescribed. So that's a whole area to pay attention to in your community and your families, locally where you live. There are better ways to cope with pain and suffering, whether it's emotional, especially in addition to using the medications. And so the reason that this is so easy to use is gotta hit the button. Okay, so I want to talk a little bit with you about rural mental health care some more. As far as lack of rural mental health, there is a major lack. There's some challenges that not only come from just not wanting to be treated or not understanding the need to be looked at or treated for mental health issues, but just the plain challenges that go on the territory, such as accessibility. In many ways, there are blocks to being able to even get care if you need it with a mental health issue. Insurances sometimes don't cover it if you're lucky to have insurance. There are travel times involved many times, and just exactly recognizing that there is a problem. You may not realize it, as I said earlier. You may deny it or just block it and not really pay attention to it. So very many accessibility blocks. Availability is another issue that's to consider. And we here in Indiana, and I'm sure many places out west and around the country, are in the areas where there is a shortage of professionals in mental health. So approximately 60% of rural Americans live in areas like that, so that there is no access to any care if they really wanted to go anyway, or no place to refer someone to. So you're kind of stranded out there. There are now more and more phone lines, which is really positive, but again, no hands-on contacts. Sometimes we can use our ministers or clergy people as a source of support for mental health issues, but beyond that, it may be very sketchy. And finally, acceptability. The other side of the coin with professionals is that many professionals in mental health don't want to come to a rural area. The money is not as good. They've not been trained to do that, and would rather maybe live in a big city and have all the luxuries of the city. So another final area is stigma, and that certainly is a factor that continues, and we're working on all the time to reduce. The fact that there is something really bad wrong with you, or that you're not a good person if you have some kind of a mental health issue, is still in the background, and sometimes affects how people react to getting treatment for their issues. Not as simple as a broken bone. There's less stigma attached to something like a broken bone than there is a depression, and so we're trying to change that. Okay. So with all these issues of stress overload, of all the responses that are going on, as well as the impact of the environment and all the problems with accessibility, we're always trying to come up with new ways of addressing the problem, especially in rural areas, of identifying and coping with stressors and improving mental health. So as a nurse with a nursing background, I very much believe in looking at health promotion and wellness and preventing problems rather than waiting until someone has a full-blown illness. Same with physical. If you pay attention to your heart and your diet and so forth, you may be able to prevent a heart attack later, very similar to mental illness. If you have a good routine for reducing stress of whatever kind of work you do or wherever you live, then you're going to have much less likelihood of becoming somehow mentally ill in a bigger, more full-blown way. So again, all about prevention and promoting mental health, and that's why I'm happy to talk about mental health first aid today. So the mental health first aid program, I'm going to describe a little bit more. They are connecting with various groups of individuals in the country and kind of setting their curriculum to deal with groups of people such as elders, rural people, people that work in fire safety, policemen, different kinds of sections, youth issues. So there's a special kind of direction for each group to take the mental health first aid course. What they do in the mental health first aid is parallel very much the kind of issues and strengths and concerns of the rural people that we are looking to help out there. And they acknowledge that there are many strengths in rural areas. Close-knit families, big sense of strong communities. You kind of depend on each other. Used to be in the old days when they were doing harvesting that all the families would get together and help one another. And there's still some of that sense, I think, of community that's out there. It's a little different with all the big farms now, maybe, but I think there's still that, especially in smaller communities. So rural mental health first aid builds on that strength. When you take a class for the mental health first aid program, you learn about what mental illness is and substance abuse issues. It helps to really appreciate what's going on. I think lack of information often leads to fear, and so this will help maybe reduce the stigma, reduce the negative ideas and perceptions about mental health, and take away some of the fear, because it can be frightening if you don't understand what you're seeing or what somebody's doing in front of you, and it's hard to maybe communicate sometimes, especially when they're feeling suicidal or like life is not worth living or hopeless. So we want to work with those perceptions and help people understand what's going on in order to intervene. So we want to support in mental health first aid what people do best. Oh my. Okay. And what they do best is help their family members and friends. So if a community is involved in mental health first aid program, they can actually learn more about it as a community, about mental health, and share information, offer support, and be able to link one another to all kinds of professional resources that may be out there that maybe you don't even know about. So mental health first aid, again, fits right in with the rural community values and beliefs and how they operate. Come on. Get this page to turn. Okay. Having trouble doing my clicker is not working. Okay. I'll try it again. I don't know if oh, there we got it. Okay. And so, a little bit more about mental health first aid. Sorry for the delay. Mental health first aid is pretty basic. It's the help that someone's offered. If they're developing some kind of a mental health problem or having a mental health crisis, so if you see someone as a layperson out there who seems to be having a problem, you're able to offer them help in a way that fits with what you're able to provide and use yourself to help them. The first aid, as it's called, is given until the person either can get to treatment that's appropriate or until there's a crisis that resolves in the moment. So it's short-term, temporary kind of help, and very much very supportive in nature, and can really make a difference in somebody's trajectory with what's going on if they're stressed or emotional or whatever. So a very powerful concept, very small action can result in very important kind of outcomes. Okay, so mental health first aid works because there are so many problems in the United States, and they're very common these days. Things with anxiety, depression. We have all the traditional illnesses, schizophrenia and all that to some degree. Not nearly as many people are diagnosed in that way as they are with just anxiety and depression and stress levels that are overload. But it's all there, and there's everywhere in the country. So stigma, as I mentioned earlier, is a big issue. So anything that people can do to decrease stigma, something like mental health first aid, is a big step towards that, to reduce the fear and the lack of knowledge. So most people aren't that well informed. There's no way you would be if you've never had any connection with anyone in your family or in your community who's had a mental health problem. There's no basis for really understanding it unless you've taken time to read and learn on your own. So as a result, people don't know how to respond. They don't know what to do. The first thing you think about is leaving if it looks like you're going to be kind of not sure what to do next. So that's part of the issue, is we don't always have to feel like we need to leave. There's simple things we can do. And if there's no professional help around, it's especially important that friends, neighbors, community are around to help with that. So the other side of that coin is, again, farmers and many other people don't actually look to get help. Even though they could afford it, it's kind of a negative against them. There's a stigma, as we mentioned. So they'll try and tough it out on their own and do the best they can to feel better. And sometimes that can be positive. Sometimes it can result in coping that may not be such a good idea or a strong way to do it. So mental health first aid then has some goals. Basically, to enhance and improve relationships among people in a community, especially in this case a rural community, so that you're creating a network or web of support. It's like a big safety net, so that people are on the same page. They understand what stress is, what responses are, how they can work together to kind of help each other that way. And can also, the goal is to develop resources. So they have information, they have all kinds of opportunity to look at resources in their neighborhood, in their area, and have those on hand to help each other cope in a healthier way. And the important thing about mental health first aid is its focus, again, on mental health promotion and preventing illness, and thinking about recovery from those issues rather than a disease or a chronic illness. So the recovery model, as you might have heard in alcoholism and other areas, is really very important and a big change. So I just have a copy here at the front of the book. In a mental health first aid class, you get a booklet, and the class is an 8-hour class, and each person has a booklet with all the information about all the different areas of mental health concern and resources, ways to work with people, outcomes. So that's gone over in the workshop of the 8 hours. But you also have that resource to take with you, which can be really helpful if you actually run into someone who might need something to refer to that, or others in your community. So mental health first aid education, as I said, is 8 hours. It's a public education program. So it's not for people who are trained in mental health or mental health or psychiatry. It's for us, lay people. It's for anybody in the community. So there are classes for people, as I said, that work with kids, but there are classes for just anybody, and you can go to any class, really. But they're trying to target more clearly now. So what they do is introduce risk factors and warning signs. And so when you see a mental health problem, you will see a certain set of issues like depression. People may act a certain way, function a certain way, not be as full of energy, not eat, not sleep. And so all these kind of are signs, and they're all laid out so you can understand what goes with that particular issue or problem. And also looks at their impact if they go on without help. So it kind of gives you a baseline to operate from. Then there's an overview for each section on appropriate support so that you can know what level of intervention you as a helper might do. They call it a first aider, mental health first aider. So each first aider can kind of titrate or understand what they need to do or what they don't need to do and have someone else do that. And the most important thing I think here is you're not supposed to be a therapist. You don't diagnose. You don't provide counseling. You're just there as a support person from your community. And again, that's like at a most basic level, but very powerful when you're there. Okay. Again, just to review what a mental disorder is, we're talking about mental health promotion and wellness. You know you have a disorder, and you can find them in a psychiatrist's book, the DSM-5 or whatever it is now. They keep adding to it. But it's a diagnosable illness when you have a full-blown thing such as a depression or a schizophrenia or whatever the illness is. But there are characteristics that they have to diagnose people with, And what we're going to look at, though, is the importance of functioning. And all of us can look at someone and see there may be something wrong and are not going as well as it could be. So in layperson's language, we're able to talk about the disorder. There are areas that are specific to this. When you have a mental illness or a difficulty in some way, it may affect a person's thinking or their emotions or their behavior. So that's a real simple way to think about how they feel about themselves, if they feel like they're not worth anything anymore. Emotional state might be crying or angry. Behavior might be, as I mentioned with depression, sleeping all day, not eating. And the other piece of this, besides how it's expressed, is their ability to function and in areas, specific areas, is compromised. So it may affect their work, just daily activities of living, or satisfying relationships. All these can suffer with a mental disorder or issues that relate to that. So important triggers that you learn about as a mental health first aider. Oops, where am I? Playing with my cursor again here, sorry. Okay. Again, the overview, here's what a program would look like from start to finish, kind of like sections. Oh my gosh, I took my page away. Where is it? Can someone help me? I'm here with you. Can you still hear me? Okay. So if you're, it's probably down below. If you are taking a course, your book has information on each area. Thank you. And the first area, again, would be what is mental health first aid. So we spend some time going over that in the class, so everybody is understanding what it really means. We look at problems in the United States, and when you have a class in your area, the teacher or the instructor should focus on statistics and areas that are near you or around you and fit to your setting, if it's in the south, the north, east, west of the United States. And another area is learning about ALGEE, and that's Mental Health First Aid Action Plan. And that's where, so to speak, the rubber hits the road. Those are the things that you as a first aider can do and are trained to do. And there's an acronym for that. An acronym, okay, I'm pushing my cursor again. Oh, I got it, okay. Yeah, there it goes. The acronym is to help you remember the order of what you would do, just like in CPR when somebody's having a heart attack. First thing you do is look for the highest level of problem, and with a heart attack, that might be not breathing, bleeding, something like that. For mental health, you look to see, is there a suicide risk or hurting themselves somehow? So that's a first step just for your own assessment. And then the biggest step next is listening non-judgmentally. I think a lot of time people think that to help someone, you need to tell them how to do things or what to do or have all the answers. In fact, that's the opposite. The most important thing you can do to support someone is to listen without any judgment and let them express what they're feeling. After that finally is done, then there's time to give reassurance and information as needed. There's an opportunity to refer them to a professional help as time goes through. And finally, if there's a need and time to do more, you can offer self-help ideas or encourage them to get more support somewhere else. So that's kind of the extent of what you would be doing as a mental health first aider in your community. And ALGEE is, you can see the first initials. They've used a koala as a model for the ALGEE as an acronym for these to remember. So that's a mental health first aid issues there. Okay, topics then, they would go over anxiety and depression, and then again look at the first aid plan, as we talked about, for depression and anxiety in situations that I've listed there. So you learn about, suicide when you see that behavior, when you see depression, panic attacks, whatever, what does that mean? What can I do? How can I help? And get someone to treatment. And that's a very helpful outline. It's also, as I mentioned, in the books that you get, so you have a review spot. Okay. Again, I think I skipped one, didn't I? There's for each area of difficulty or problems, there's a section like that: substance use, disorders, addiction. Again, an action plan. You find somebody who's overdosed, just what's going on, what you can do as a volunteer and a helper, and how to move them forward. And psychosis is another area. So they're each taken through 6 or 7 areas like that. So by the end of that 8 hours, you have a pretty full picture of what your role would be and how you can help others in your neighborhood and community. So building your skills as you go through this class, it's very experiential. It's pretty low key. It's, again, in layman's terms, so it's not meant to be for a psychiatrist. And as you go through the class, you are able to learn basic skills that fit for each disorder. So you know what to do when somebody's depressed versus maybe manic or really angry. So you have scenarios that you get to see, role modeling, learning that way, as well as being able to just practice skills yourself in a safe environment so that you don't feel embarrassed or whatever. We're all in it together. And lastly, what they found is your confidence increases when you're able to practice it, even a few times in a class like this. Practice those skills and be able to really own them for yourself to use later. Effectiveness of the program, it's been, history-wise, it's been around in the United States a few years now. So far, there are just less than 10 years, or maybe 12, 15. There are 4 published randomized control studies, and there's a qualitative study as well. And what they've found in these studies is that mental health first aid increases mental health literacy for the community, so people that take the course really understand better what's going on, and their knowledge is expanded on how to help someone so they don't have to back off and feel like they can't be helpful. And it very much connects people to services. So if you have a list of even a couple of things that are available in your community, you can share those with that person or with their family, and they can maybe get more help there. And also, as a result of all those steps, their stigma gets reduced. So people understanding, again, gives them more of a sense of power and efficacy or ability to help than they would have had before. Okay. This is the hardest part, is doing these clicks. Okay. I think there we go. It goes to sleep when I'm here talking. Okay. The development of mental health first aid, we're just about to the end here, but it was started actually in Australia in 2001. And interestingly enough, it was a woman who is a nurse and a mental health nurse, and her husband, a psychologist. And they were at the University of Melbourne, and they're their auspices. And they lived in an area out in the country. It started in a rural area where there were limited resources. It happens that the nurse, the wife, had depression herself and felt like there needed to be something to kind of help her and support her to get out of her funks or her depression when she got into it, something very simple like this. And so they started the program. In 2008, it came to the United States, and as a result, it grew, and now there's a youth mental health first aid class that started in 12, and that's for the teachers and parents of youth versus the kids themselves. And now there are special versions which have been developed, whether it's for veterans, the rural settings, public safety, higher ed, and all and in Spanish too, so it's a Spanish version. So actually you can get certified to add those areas, and I have that for the rural settings and for veterans. So it's happy to be able to share it. Just tailors a little more to that group. Statistically, the growth of mental health first aid, there are now over 10,000 instructors, and this was a couple of years ago, starting from 0 in 2008. 1 million people or more have now been trained in the United States, just regular folks, and it's in every state as well as Puerto Rico and Guam, as well as 20 other countries over the world, plus more every day, so I'm sure it's changed by now. So it's a powerful program. Whoops. Very powerful program. If you want to look further into mental health first aid in your community, the best way to do that is, if you have questions, I can help answer them, or go to the website, www.mentalhealthfirstaid.org, and it will tell you more about the program in detail and how you can bring it there. You can actually look at that and share it with your community locally or in one section of your community to start and see if there's interest in it. And see it as a community program is really very powerful. Or I've done programs even within hospitals, within faith communities, so you can set it up to work with whatever group you think it would fit with. And you can have 25 to 30 participants in a class. So that's quite a good group. If you decide you want to do classes, there is a list of certified mental health first aid instructors. In that website, you can search and find your area and somebody local to you. Or if you can't locate someone in your neighborhood, then people can travel to your area. And you can set up classes, convenient times, and then there's marketing that goes with it. It's a whole package that you can work with. Locate someone in your neighborhood, then people can travel to your area. And you can set up classes, convenient times, and then there's marketing that goes with it. It's a whole package that you can work with. Especially less businesses, and law enforcement is, I think, a need that's out there. I've worked with some veterans and quite a few farmers around the area Midwest, and just community leaders. So anybody is fair game for this program and can learn, I think, a lot from this to help others. So my last slide or so here. The vision, actually, for mental health first aid, I think is kind of important since it got here a few years back. Right now, what they say is that it would be really in their vision to see mental health first aid being treated and seen as just like CPR and first aid classes. So very common, very accessible to everybody, and just a basic helpful skill set that you can add to your armamentarium or toolkit that you have to be a part of a community and be a support person and help those around you as well as your own families. So I believe that's all I have here. I think my other slide has information where you can reach me if you want more information. I have a small practice now. I was teaching at Purdue University in nursing and decided I wanted to do some things that I really enjoy doing, and so I'm certainly available to do workshops and classes as well as all the instructors that are on the website there. So again, thank you very much for hanging in there with us as we went through the computer technology phases there. And I guess we have time for questions, or I'm not sure. So back to you, Paul.
Thank you very much, Roberta, for not only your presentation, but your patience with our technical problems.
Okay, that's a question that has many. Am I on? Okay. Question that has several possibilities to answer. There are areas in the country, and I think 15 states now have programs that are sponsored by the state that actually are doing the classes free. So if anybody in your state is a grant writer, that's a wonderful way, or sponsors. In addition to that, people that are offering classes, most of them probably at this point, the other states, are charging anywhere from, well, first of all, the book is, I believe, $36, but price might have gone down this year. It's a pretty valuable book. It's a kind of high quality glossy stuff, but it's a resource forever. So that's helpful, I think. And then there are charges that may be incurred by people in your local community or partnerships, anywhere from, it's hard to say, from $10, $15, $20, $30, it varies with the place, the location, the environment, a wide variety of things. So the best thing to do would be in touch with one of the instructors or someone in the state if you have someone doing it, and check with them. It's hard to be too specific with that. So many situations that are different in different areas of the country too. So it's variable, the short answer.
Okay, here's a question from Bob, and I will read that. Besides going to the website, what steps are there to bring mental health first aid training to our state AgrAbility project?
Good question.
What does it cost?
Ready? Okay. Actually, I was sponsored by, as I said earlier, AgrAbility, And that was it was in, what year was that, 13 or 12, 2012 or 13. At that time, I believe it's not cheap. It's like $2,500. Plus, at that time, you had to fly usually somewhere to go to the class. And so I had air travel expenses and hotel because it was a week long. When you go to a training to be a faculty, you go through the program the first 2.5 days or so. So you have an experience of actually going through it like you would be a student. And then the last, or I guess maybe 2 days, then the last 3 days you actually go through. So it's pretty intensive training for something like this, I always thought. You go through exams, written exams. You have to do a live example of your teaching. You get assignments to work on, and everybody does live and gets good critiquing. So it's more than just sitting there. So I guess maybe that accounts for some of the money. But yeah, I actually don't know as of today what it would cost. I believe it says somewhere in the website. You can look it up and find it in there, or if I can find it, maybe we can pass it along if it's not there. But yeah, it's very well done. Like I said, the main thing they emphasize in that program too is if you are a professional, they don't want you to act as though you are a professional in the area when you're teaching, as much as be accessible to other people out in the world. So.
Okay, one other question here. Is it possible to renew a mental health first aid by taking the 8-hour course a second time?
Well, I don't think you need to even, well, you may. It depends on how long it's been since you took the course. They have gotten a little more tight. It used to be fairly free at the beginning and kind of loose at the beginning as far as how you could be recertified. I believe now they have something you can do online and go back and look at that. Again, if you have trouble finding that, again, I can try and look it up, or you can connect on email with the person there that's in charge of that. There's a name. I don't know, it's changed recently. So there's a way to go about that, though. It doesn't mean you have to take the whole course again. At least, hope not. So, good question.
How can I find out more about the rural veteran and other trainings? I was not able to locate them on the mentalhealthfirstaid.org, and I think that's probably the certifications for those things.
Yeah, actually you start with the basic certification, adult or child. If you take the adult certification first as an instructor, then you, I mean, they mean as an instructor, right? Not as a participant. I'm not sure. If you, okay, I'll do it both ways. If you're a participant and you want to be a participant in a class that deals with rural or veteran, then that's on the site. If you look for the instructors in different locations that are offering classes, you would be able to see a designation if they have the certification additional for the focus for veterans or rural. So it would be on there. If you're a faculty member, you first take the basic course that week I was talking about, and then there are, for the faculty, you can do online and web educational process to finish up that additional little focus point. It's not as big of a long course, extensive. It just helps you to frame what you're teaching in terms of that particular group or environment.
Another question, Roberta, did you say that the book costs $36 per person and training is $10 to $15 per person?
Okay, again, I did not today, I'm sorry, check the latest cost of the book. My sense is it probably has gone down. That's what it was the last couple of years. But probably as the volume gets higher, they may be decreasing the prices. And we'll have to look that up for sure and find out, because I don't know if that is on the website. And the classes, again, it depends totally on where you're taking it. So again, if your state is one of those lucky 5 or 15 rather that is doing it as a grant for free, then you're covered. And that's wonderful. Otherwise, it will kind of depend on where it is, and you have to look at the website, and they should tell you that information under the instructor. So if you look them up and see a date when they're offering it, look for the instructor, and there's a place to register and actually ask questions.
Okay, I believe that's all of our questions that we had today. Again, thank you to everybody for joining us and for hanging in with us through the technical difficulties. A special thank you to Dr. Schweitzer for all of her efforts for sharing her expertise and also for putting up with our technical problems today, which she did very graciously.
Thanks for the opportunity.
Well, thank you.